All right. Good afternoon, everyone. I am just going to, here is the title slide. You've seen that. So today I hope to provide an overview of DSMES services that can be implemented in an FQHC, and then provide an overview of the opportunities and challenges that technology brings from scheduling and assessment to delivery and follow-up in DSMES services. So first, I just want to start with background information. What is DSMES? So DSMES stands for Diabetes Self-Management, Education, and Support. Everything we do tends to be a bit of a mouthful, but DSMES interventions include activities that support the person with diabetes to implement and sustain the self-management behaviors and strategies to improve diabetes and related cardiometabolic conditions and quality of life on an ongoing basis. The purpose of DSMES is really to give people with diabetes the knowledge, skills, and confidence to accept responsibility for their self-management. This includes collaborating with their healthcare team, making informed decisions about their diabetes care, solving problems, developing personal goals and action plans, and coping with emotions and life stresses. Really, when you think about what do we do in DSMES, is really helping people with everything in between those doctor visits, those clinic visits, really helping people, informing people on how to make decisions that come up day to day. I've heard some data that people with diabetes are faced with somewhere around 200. I've seen data with more decisions every single day related to their diabetes, from what they're going to eat to if they should check their blood sugar. Is it safe to go out for a walk? Should I call the doctor? That is really what the purpose of DSMES is. It's really to provide people the knowledge so that they know how to manage most situations that they're going to be facing, but also to know when they do need to call their doctor or come to the clinic or go to the ER, or get more help. So I want to just talk briefly about when DSMES is recommended. And this comes from, there was a 2020 consensus report of 7 different organizations, including ADCES and many other organizations. Obviously, I said 7. So really coming together on when are the critical times to refer for DSMES. And so I just want to go through these pretty briefly, but anyone who has diabetes or is newly diagnosed really should receive a referral for DSMES at that point. They're going to have a lot of questions and really kind of informing them of the information they need to really manage that day to day. Diabetes changes over time, though. What you're dealing with at diagnosis is going to be different than what you're dealing with in a year or two. When everything is new, it kind of is like, okay, I can take care of this. But that gets old. So for most people, so really annually, or when they're not meeting treatment targets, is another really critical time where DSMES services can help. Another important time is when complicating factors develop. The infographic on the left is kind of highlighting these different times, but I think of complicating factors is times when something else happens. We can think of common things that may happen when someone has diabetes. Maybe there's some problems with vision, or they have an injury that causes higher blood sugars and healing, so they need a little bit more help. Maybe they're given a prescription for a steroid for another condition that's going to impact their blood sugar. So really important time to connect with that diabetes education team. Another time may be, another disease. I had a lot of patients when I was working clinically. Maybe they got diagnosed with cancer. It was being treated, but that really does impact their day-to-day diabetes care, and kind of making decisions. Everything can change in kind of how their body's dealing with all these different things. And so those are really important times to meet with a diabetes care and education specialist or a DSMES team. And then the fourth really critical time is when transitions in life and care occur. As you can kind of see from the picture, when I have 6 nephews and a niece, when they go off to college, thinking of that's a time when they were working, their parents were cooking their food, making sure they got things done. Now they're off to college, they're on their own. And they're having to make decisions, being faced with decisions that maybe they had a lot more help with at home. So we want to make sure they have the support and understand how to deal with those things. So maybe they've had lots of DSMES, in a pediatric clinic, but as they move on and become adults, that's a really an important time. But also other pleasant or unpleasant transitions, marriage, divorce, death of a spouse, death of a family member. These are all really important times. If you think of anything that affects your day-to-day life and changes your routines, is a really important time for someone with diabetes to meet with a diabetes DSMES team. I just moved into a new house a year ago. It changed all of my routines. Very exciting time, but it really would have been a time if I had diabetes that could really throw things off and I would need some help. How do I navigate this now? Or when a family member passed away, maybe I don't even live with them, but it's really affecting how I'm dealing with day-to-day life. And it's an important time to look at how can we, help better self-manage diabetes. So there's several acronyms, as I said, there's a lot of long words and a lot of acronyms in this profession, but I just want to clarify DSMT. So it's analogous to DSMES. Medicare has a benefit and it's called DSMT, but it really, if you were getting DSMT services through Medicare, you are being offered DSMES. So the Medicare benefit was established in 1997 and finally published in 2000. So it's been about 22 years now that this has been a reimbursable service. The regulations do state that the program must be accredited to meet the national standards for DSMES or the CMS quality standards. There are accreditation is required to be reimbursed for this service. And there are currently 2 accrediting organizations for Medicare today, ADCES, that is my organization, and ADA, the American Diabetes Association, are the only 2 organizations certified to accredit programs for DSMES. I'm going to talk a little bit about the benefit because a lot of this is background information that you kind of need to kind of get through the next piece. So the benefit does require a specific referral from a qualified professional. Now, it's different than some other benefits. So I just like to clarify, it needs to be that MD, DO, it could be an NP, an advanced practice nurse, or a PA who's overseeing that beneficiary's diabetes. Now, this is for Medicare. Some Medicaid and other private payers may do the same, but I just want to be really clear that I'm talking about the Medicare benefit here. Medicare beneficiaries are entitled to 10 hours of initial training. This is once in their lifetime, and it doesn't have to be at that first diagnosis. It's once they're on Medicare, they're entitled to those 10 hours. But those 10 hours need to be used within 12 consecutive months. So it's really important that when someone starts this, that we kind of make sure they're getting the DSMES needed. Research shows that 10 or more hours are what benefit people with diabetes to really be able to self-manage in a meaningful and effective way long-term. I just like to clarify those hours don't roll over. It's use it or lose it. So if you haven't used all 10 hours, say after 10 months, you've used 6 of those hours and you don't go back, then the following year, you're eligible for 2 hours, and you are eligible for 2 hours every year for the duration of your lifetime as you have diabetes. I also should mention that DSMT, the benefit for DSMES, is approved for telehealth during the public health emergency. Now, in federally qualified health centers and rural health centers, there is legislation currently on the table to extend that more permanently. I just wanted to mention that as of right now, it's approved during the public health emergency. And it can be provided via audio only, so on a regular telephone, old school, or audio video like we're doing here in a Zoom call. There is a hyperlink at the bottom of this page that gives you a template for that DSMES referral with all required components on it. So that can be used as a template to build your own, or you can just use the form as is. And there's more information at this link as well that describes a little more detail about the benefit. So we have a quick polling question, and I'm going to give Sylvia a minute to get this up there for you. But the polling question right now is how many hours, oops, I'm not seeing the right polling question up there, Sylvia, but it's how many hours of DSMT are allowed each year for Medicare beneficiaries with diabetes? And so the potential answers are A, 10 hours, B, 3 hours, C, 2 hours, or D, none.
If everyone can please respond in the chat, that would be great.
Great. And I'm going to pull up the chat. And it was a little bit of a trick question, I can see by the responses. So every year they're entitled to, give people a few more minutes as the response is coming in. I'm seeing a mix. So if you answered 2 hours, that is correct. The 10 hours is available initially and once in a lifetime. The 2 hours is available every year for the duration that you have Medicare as a benefit. And that is offered in 30-minute increments. Now, I want to talk briefly about some differences. If you've talked with others or you know people who are part of DSMES services in a different type of setting, it is a little bit different if you work in a federally qualified health center, an FQHC. You are reimbursed based on a medical visit. So you are going to use 2 codes if you're an accredited program to bill for DSMES. You're going to bill that G0466 or G0467, depending on it's a new patient or established patient with the clinic. And then you're also going to code it that G0108 for DSMT one-on-one. As I said, telehealth visits are reimbursable during the public health emergency, but I'll mention that group sessions are not reimbursed by Medicare under these codes at an FQHC. So DSMES services in an FQHC are generally delivered one-on-one with the beneficiary. In a rural health center, the same code, G0108, is used, but in a rural health center, and it's one-on-one versus group settings, at least to be added to the cost report. So again, telehealth services are allowed, whether it's audio only by phone or audio video. I've got the images here to kind of help connect those dots. But in the rural health center, those DSMT visits are added to the rural health center's cost report for CMS. So they're not payable per visit, but this can increase the all-inclusive rate that the rural health center receives for all of their services. So there definitely is a benefit financially to do this. And just a reminder, DSMT visits are reimbursed as a federal FQHC medical visit, but also coded as G0108 to indicate that DSMT was furnished. So moving on, the national standards for DSMES are what the basis is, and they outline the latest evidence for effective and sustainable DSMES services, kind of provide a roadmap for practitioners or professionals to implement DSMES services across any care setting, really. The intent is these are doable regardless of if you're in a FQHC, a big hospital, a small community pharmacy, or a community-based program. They're aimed at ensuring quality services are being delivered to people with diabetes, regardless of where the setting is they receive the DSMES, and they serve as the basis for accreditation and recognition required to be reimbursed by Medicare for the G codes. These standards were updated in 2022. As you can see, the new document is on the right there, and you can upload that from our website. I just want to go over quickly the guiding principles as they revise those standards. If you have heard in the past that applying for accreditation or DSMES is complex, yes, there's some complexities. It's a lot of letters, it's a long word. There are some steps in order to get reimbursed, but these standards, the main focus of the updated standards that were released in 2022, and now all programs are aligning with, were to review the evidence, That working group reviewed the evidence to support DSMES across all care settings. I think we did a really good job of making sure that those requirements met the needs of any different care setting. Another guiding principle was to reduce the administrative burden related to DSMES implementation across any care setting, and to clarify and reduce ambiguity regarding medical record documentation. So if you're thinking, wow, it seems like it used to be harder to do this, you're right, it was. I was ran a program under the old standards, and it was complex, and sometimes I didn't even know I was doing why I was doing some of the things we were doing. Now, I want to focus on this increase access and health equity, because I think this is really relevant to this audience, is that was one of the goals that we're still waiting to see if reducing the barriers and burden will really equate to more access. And just a snapshot here, I'm not going to go into tons of detail on all of the standards. That's not what today's topic is, but I just wanted to give you a glimpse at what the standards look like. There are now 6, there used to be 10. The first 3 are really the structure of the services, the support, who you're serving, and who's going to be on the team. I'm going to focus today mostly on delivery and design of DSMES services and person-centered DSMES. Those are the 2 standards that relate most to our delivery of DSMES. And then there's always outcomes, measuring and demonstrating outcomes of DSMES services, which kind of goes hand in hand with working in a federally qualified health center. So standard 4 is the delivery and design of DSMES services. This is really what we do every day. And the evidence shows that various modes of delivery can support increased communication between people with diabetes and the team and improve diabetes-related outcomes. And strong evidence supports DSMES delivery through virtual, telehealth, telephone, text messaging, and web-based mobile phone apps. I want to point this out. These are direct quotes from the actual standards and part of standard 4. So these aren't my words, these are words of that paper. And this is a little bit more to that. So really thinking about, how does DSMES delivery and technology work? Now, I mentioned that DSMES can be delivered via telehealth or audio only. So first and foremost, and Megan's going to talk a lot more about this, you need to be sure the patient you're working with is able to use technology, has the capacity to do it, and has the technology, and chooses to use technology. I may be really savvy at these things, but that is not how I want to get my diabetes education, and that has to be respected. But many people, it can add a lot more convenience. Thinking in terms of what we do in DSMES, sharing data, for example, diabetes devices. Someone who's wearing a continuous glucose monitor can upload their data and share it with the DSMES team to help inform either that next visit, or to say, hey, something's going on with my blood sugars. Can you take a look? This was something very common that I did in practice, and many of our teams across federally qualified health centers in every setting are doing today. There's many different ways to do this. Maybe they have a portal within their EMR. Maybe they're sharing through the device app. But there's a lot of ways where this can benefit both the patient and the team for efficiency and for better outcomes for everyone. Also, sharing data from health trackers. I know I always had my Fitbit. I recently got a different type of device, and it does all kinds of things. So those health trackers may be valuable. Patient logs, as we ask people, I'm a dietitian, I'm always asking people, at least write down some of the things you're eating. Let's see what you're eating, get a sense of this. These things can be shared, in advance of a visit or in between a visit, to help inform sort of next steps, or just increase that communication and that feedback. So meeting with patients virtually, there's a lot of different ways to do this. You can share screens. You have to get comfortable with the technology, though. Sharing a screen can be tricky. I've often accidentally shared my emails. Maybe an email that I didn't want someone to see came up. That's the thing that you've got to get used to. So I think that's kind of a challenge, both for the team, especially as the pandemic began. A lot of our teams were just learning this new technology, whether it was Zoom or Teams or whatever HIPAA compliant software they were using. You really got to get savvy with it. You want to have your visual aids ready. Some of the quality coordinators have shared with me, they have a file on their desktop and they have all their visual aids very clearly labeled. Think of the patient handouts you used to provide in person. A lot of these have been adapted for web-based use. So when you're delivering DSMES one-on-one in an FQHC, you still are going to have some visual aids you want to use, talk through, and think about to share, and those need to be handy because you're not going to have as much time to grab them out of the cabinet as you would kind of getting that on the screen. Those things take practice, and what we're hearing from our clinicians and experts is that yeah, it took time. Patients are usually really understanding. We're all struggling, and everybody kind of understands that it's a learning curve. Also mention IT support. Think about, do you have IT support? It's one thing to have a patient who's like, I'm struggling with getting with technology, and you say, okay, I am not an IT person, so let's just flip to a phone call. I can mail you information later. But if you're having IT needs, as we were getting this started on this call, one of us was having a little bit of challenges with technology, not their fault. They were just having connection issues where they were. These things can happen. Make a plan B. The other thing to think about, I always think about a plan B, is really your patient might have distractions. You have a window into their life, which is a real good benefit, but there can also be distractions that make it difficult for them to participate in DSMES. And that's something to think about. Set expectations with your patients. Also plan for emergencies. One of the questions that came up early on is, what if something happens in another setting, someone has an emergency? Be sure that you have a phone number. Before you get on the call, make sure you have an alternate method for reaching the patient or someone that you need to if something were to happen. Just like in a clinic, if someone were to have an emergency situation, you have protocols. You need protocols for telehealth. So just a few little comments. And then one last thing I want to mention here is physical limitations are something we need to be more aware of, potentially when we're doing DSMES virtually like this. If you haven't met with a person, they might not be as visible, or limitations may be more visible, but just something to really think about in more detail. I always think here's some really great benefits. Let your patient share and tell. Food portions and labels in their home. We're talking about their foods, the things in their fridge. I've had our members say they go to the fridge and the person shows them their fridge. What a great opportunity to really have a window into their life so you can help them with the day-to-day. Medications in their containers. They can go through their containers, show you how they're taking them. Include family members if they want, but be respectful of how that works. And if they want their family members involved. Another lessons learned, our members are saying, consider shorter, more frequent sessions. They might have been able to do a 1 to 1.5 hour session in person. Nobody's going to want to be on a Zoom call for that long. A lot of our programs are aiming for half hour or half hour visits, sometimes are an hour, usually no more than that on a Zoom call. Converting handouts to share on screen, like I mentioned, and consider mailing resources before or after if you're doing audio only visits. If your patient says, no, I can't do the audio video stuff, I just like to talk on the phone, depending on what you're talking about, you might want to plan ahead to say, hey, I'm going to send you some stuff that we're going to go over on the phone, and you go snail mail. That still works these days. So the next standard I'm going to talk about is follow-up and ongoing support. I think this is more kind of a more established and well-known use of technology in DSMES. It's connecting people with technology-enabled solutions to help them engage with their online community or others locally, even for that psychosocial support between and beyond DSMES sessions. Again, this slide is really a direct quote from the national standards. In mobile apps, there's digital therapeutics out there, there's online programs and peer support groups. Get to know what works, get to know the different support type options for your patients that are available locally or online that are that might meet their needs. There's groups that are focused on women and maybe rural communities, really knowing what might be needed. What I'm hearing from our programs is that what we're seeing most common for this follow-up and ongoing support, really we're seeing more of a hybrid approach. When patients are in the clinic, you may get to see them in person, but in between, it's hard for them to get there. So doing check-ins and follow-ups once you've kind of established that rapport is going really well virtually. There's a time and place for everything. There are certain visits that don't lend well to virtual. Someone has major vision problems, you're trying to teach an injection, you may want to do that in person, or anything complicated. But depending on the scenario, some things lend really well to this sort of audio video. And then thinking about if it's audio only, what can be done. And at some point you do need to see things. In my practice, you need to see infusion sites. Are they giving the shot in the same spot every time? Knowing what's going on can make a big difference in diabetes care. Text messages can be used to check in on progress with goals in between visits, making sure your patients agreed to that, and that's you're kind of following HIPAA rules in terms of how that communication is occurring. Ongoing support groups, like I said, those can be in real time, or they can be done through a platform as needed. And then standard 5 is the DSMES assessment. So any DSMES service is well aware of all the different assessment items that we're looking at. And my next slide, again, this slide goes over what's in the standards. This slide kind of highlights some of the things we're looking at. So what type of diabetes they have. Some of this stuff you're going to find in the EMR. You don't have to ask this directly of the patient. You're going to say, well, the nurse I work with just asked all this stuff last week. Now I'm on the phone with this person. So a lot of this stuff you can gather from other charts, other notes. But really a lot of this stuff may also be obtained through a survey that's sent through an EMR portal or through a website or through email. So really thinking about how you get the most out of your visits and getting to know that person in different ways and using technology to help. So I just have a quick question for all of you to enter in the chat. Just kind of seeing how are you already using technology to connect with your patients. And so if you want to go ahead and enter in that in the chat as I go on, I will kind of call out some of the things that I see. If you're using technology to do certain types of visits, share with us and give kind of some of your colleagues that knowledge. But just to recap, technology and DSMES go hand in hand. They kind of have for years. We're using a lot of technology in our visits, during our visits, even when they're in person. From assessment to scheduling to delivering the education, scheduling, a lot of this can happen and I'm seeing a lot of this in the chat, scheduling appointments, reminder calls, reminder texts, thinking of how to share data, following up with people. Maybe you're just following up on a goal that was set and you just want to see how you're doing with that. We don't have any more visits, but I do want to see how you're doing. Helps build that rapport and that long-term relationship with your participants. And so just a quick summary before I hand it over to Megan. I'm seeing a lot of phones, scheduling, appointments. A lot of you are using a lot different type of text, virtual classes to patients with diabetes. So it sounds like a lot of you are already offering all of this and have a good support groups via video. So technology and DSMES go hand in hand. Telehealth visits, know that DSMT is on the list of Medicare services. Just a reminder of that. Gives you a unique window into your patient's day-to-day life. Teaching some things is even better virtually. What I've heard, another kind of tip or pearl of wisdom as the pandemic began, and I was hearing from our quality coordinators, what I was hearing most commonly was, I'm having so much more valuable conversations with my patients. They're asking me questions and I'm answering their questions. And it's so much more rewarding because I know I'm giving them the information they need right then and there. And really thinking they're in the comfort of their home environment versus coming to your clinical environment where they're less comfortable. So in their home environment, their needs are going to be more immediate. They're going to be able to think, oh yeah, I always forget to take my insulin at this time, or different things that might be just more relevant when you're in your home environment that you're thinking about versus being removed from that. So lots of different ways, but other messages from our folks is iterate. It may not go well the first time. Figure out what's best for your team and each patient, and be prepared to adjust and adapt as you find what works best. I think as we've all learned over the last couple of years, change is the constant. We're always going to get curveballs. And in this new environment, things are, we have to adapt to the circumstances as we go. So start slow, plan, and iterate, and know that that's okay. And your patients understand if you're struggling with technology. They actually appreciate to see that sometimes. They feel like we're on the same level as them. And my contact information is here. And without further ado, I want to hand it over to Megan.
Thank you, Sasha. Good afternoon, everyone. I apologize for not having my video on this afternoon. I got a bee sting earlier today. My face is a little swollen, so I apologize for that. On this part 2, or in this next part of today's webinar, I will be providing you with a brief overview of a guide that we have created for patient self-management of chronic illness through tele-education. So as we all know, with the start of the pandemic, there's been many changes that have been implemented at health centers, and we've had to come up with new ways of staying connected with and continuing to engage patients. Some of you already mentioned lots of different ways that you're currently using technology to engage with patients and to continuing to have successful communication with them, to share resources. I saw in the chat, you all mentioned using video, phone calls, text messaging. I also saw someone mentioned that you utilize the Zoom platform a lot. Can we hear a little bit about what other platforms you all have been using? If you can just plug into the chat, what other platforms aside from Zoom have you all been using to engage with patients virtually? While Microsoft Teams, while you're plugging into the chat. So there's so many different platforms, right, that can be used. And a lot of you may already be using them. We all know that a major part of successful patient self-management of diabetes and other chronic illnesses, just like Sasha was mentioning, and kind of adequately providing patient health education. One of the main components of that is truly building trust with the patients and having that frequent, consistent communication. And sometimes there can be challenges to do that virtually, right? DocsMe, Epic, Microsoft Teams. Yes, thank you for plugging that in. So this, can you move to the next slide, Sasha, please? Thank you. So this guide that we created, we're specifically focusing on utilizing the WhatsApp platform. I haven't seen anyone plug that into the chat, but we have seen that the WhatsApp platform is a good platform to use virtually because sometimes a lot of the patients are already using WhatsApp in their personal life. So transitioning to do that, to provide health education, there may not be as much support needed as opposed to a platform that maybe they haven't seen before. So before we dive into the WhatsApp guide, we have a little poll here. And there's 2 questions. One, if you can please answer if you have ever used WhatsApp, just indicate yes or no. And if you answered yes, was it for personal or professional use or both? We just want to kind of gauge and get an idea of how many people are familiar with WhatsApp. So it looks like 79% yes, you have used WhatsApp, 21% no. Most people have used it for personal use, and a few for both. Thank you. So now we can go right into the guide. Next slide, please. Yeah, this is just the main page that you'll see on the guide. And so this guide, this is the first page. This guide for patient self-management of chronic illness highlights one way of providing tele-education to patients using WhatsApp. So for those who may not be familiar, WhatsApp is a virtual messaging application that allows video and voice calls text messages, and so much more, all through a wireless internet connection. So one thing to highlight on this page that we included is HIPAA regulations. So we just want this to serve everyone as a reminder that due to HIPAA regulations, WhatsApp is allowed for tele-education, but not online healthcare delivery, since it's not a confidential platform. So of course, the exchange of personal participant health information is prohibited. On this next section, part of this guide, which we'll see a little bit later, is the tele-education readiness assessment. So like Sasha mentioned earlier today, we have to assess, right? We have to assess what are the needs of the patients? What do they have access to? Do they have access to a phone? Do they have access to a computer? Do they know how to download WhatsApp? Are they going to be needing assistance downloading it? How comfortable are they in using the platform? So we're going to go a little bit more into the assessment later, but that's kind of what this section highlights. The first section, participant readiness and assessment. And then right after that, we jump into the WhatsApp platform and features. And so the first feature that we highlighted are group chats and activities. So you can have individual contacts with your patients or with participants, or you can create a group. So this feature, and we kind of give step-by-step instructions of how to create the group, letting you know which icons to click on and all of that. Let me see. And then next slide, please. The second feature is the voice messaging. And then the third one is the audio or video calls. So there's many different things that can be done with voice messaging, right? Voice messaging allows you to record an audio message and send to another person right away. So depending on the device that you're using, as well as the settings that are on your application, you may also be able to first, and some of you who utilize this for personal reasons probably already know of this feature, but if you, depending on the device, you may be able to listen to your recording and then choose to delete it and re-record or send if you're happy with the recording. But this is good for those of you who do voice messages with your participants. And then audio and video calls. Calls can be conducted through audio or through just video. Calling participants does allow the health center staff the opportunity to really stay connected with the participants in a more impactful way. And it encourages the participants to kind of maintain personal accountability for their health, right? So you can always call the participant just by clicking on their contact information, or again, you can choose to create a group. You can do video calls. Just like Sasha mentioned earlier, video calls is a really neat feature virtually, because you can actually go into the person's home, right? And look into their refrigerator, look into their food pantry, help them read the food labels, kind of maybe even help them with meal preparation. There's so many different things that you can do video calls with and kind of have that deeper connection with the participants. Next slide. And then the fourth feature that we highlight is file and resource sharing. Again, this is a really important one because you can share health education materials to your participants through either videos or photos. You can convert materials into PDFs and change and send that. You can send the actual documents just by uploading the files from your phone. And you can send things like, or maybe the participants can even send you photos of themselves exercising, or maybe photos of their daily meals, just to kind of continue to hold themselves accountable. Maybe again, do video with them, reading food labels at the grocery store, even while they're shopping. It's very neat because you can share this from, they can be at home, they can be at their workspace, they can be at the grocery store. And then again, it gives you step-by-step instructions of how to share a resource simply by clicking on the camera button. So now that's a little bit about the different features that WhatsApp has to offer. And the next part of this guide, we touch on strategies for participant self-management via WhatsApp. So after getting familiar with the features, you can utilize these different strategies to kind of help participants increase self-management of their diabetes or any other chronic illness. Within this guide, we specifically touch on two main chronic illnesses, which are diabetes and cardiovascular health. So like having patients check their blood pressure, teaching them how to check their glucose levels before and after meals. And you can do this by conducting like either daily or weekly check-ins with the patients. And you can use those individual chat messages, or you can use the voice messaging to send these reminders about checking their glucose levels, their cholesterol, monitoring their blood pressure. You can also check in on their progress and remind them of any upcoming appointments that they may have, or maybe any events that are being held at the health center or in their area. Next slide, please. And then the second strategy that we highlight here is conducting private audio or video calls with participants, again, to provide that more individualized healthy discussion, or conduct one-on-one virtual health education sessions, like the DSMES sessions would be a great thing to conduct via WhatsApp. And again, just remembering those points that Sasha touched on, maybe holding the class for a less amount of time, things like that. And video sessions can also be conducted to show participants how to use different types of health monitors at home. So a lot of times, you send a patient with the monitor, and even though you may teach them how to use it while they're in the health center, maybe they go home and they forget, or they don't remember. So you can easily just do video session with them one-on-one. And as they're trying to use a monitor to check their glucose levels, you can assist them step by step along the way. Same thing for checking their blood pressure. The third strategy that we highlight is really promoting virtual accountability by using the video calls or the file sharing features. So you want to encourage the participants to really share pictures, again, of daily meals, send video of grocery shopping, send video of exercise routines, maybe get the family, have them get the family involved at home, do something fun out of these video sharings, right? And Maria plugged into the chat for those of you who might need access to different kind of health education resources or videos. We do have a diabetes resource hub that you can always reference, and you can grab files from there and use the WhatsApp video calls or file sharing to share those files. And then the fourth strategy is send daily health resources and referrals with participants related to their chronic illness, using, again, the file or resource sharing. Next slide, please. So specifically regarding diabetes or cardiovascular health, resources surrounding diabetes can be like healthy eating, staying active, maybe sending them a couple of different recipes that do fit their everyday lives, and just kind of keeping that cultural component in mind. Maybe sending them at-home exercise techniques or tips on managing stress, or ways to involve the family in just overall living a healthier lifestyle. You can also send resources such as financial assistance options that may be available for different medications that they may be needing. And for cardiovascular health, the same resources that include staying active, healthy foods, family recipes, talking about alcohol intake and decreasing tobacco use, or again, tips on managing stress and financial assistance. Resources can also be shared on the way that individuals should be seated whenever they are checking their blood pressure. So really giving them an accurate portrayal of that. And then the fifth strategy that we highlight is hosting group events to promote peer-to-peer support by using the group video call feature. So you can actually host group events, like maybe do a Zumba session or have a cooking demonstration, or even celebrate special occasions with the participants and their families, just to really, again, bring in that engagement and really add to that connection that you're trying to build with the patients. And they can do this all from the comfort of their homes. So it alleviates any problems that may be, or barriers that they may be facing, like maybe they don't have transportation, maybe they don't have childcare, whatever it may be, they can do this all out of the comfort of their homes. One note that we did include as part of this guide is that the WhatsApp personal account application typically allows up to 12 participants to join at a time on a group video session. But you may download the WhatsApp business application, which is free, and it allows for more participants to join in. So just noted that that is an option that you have. So once again, this guide, we really created it as to offer an option that you can use with your participants to really implement those DSMES programs, to stay connected with the individuals, to help them self-manage their diabetes or other chronic illnesses. And it just really allows people living with diabetes or other chronic illnesses the ability to receive the health education that they need without having to be physically present at the health center setting. And it also allows participants to really communicate. They'll have the ability, it'll maybe make them more comfortable to ask the questions that maybe they typically are too embarrassed or don't want to ask in person. They can just send a quick text message, or you send them a quick chat, and maybe they'll be more open to discussing whatever questions they have regarding their health. And then this next section on the next slide, here we go into the assessment that we were previously talking about. So this assessment, you can see it highlights lots of different questions, a variety of questions, which you'll be asking participants. It touches on participant willingness and need, their accessibility to internet and devices. And a really cool thing, you can either print this out and have the individual do it on paper form, or they can do it electronically. And the neat thing is about this, if they do it electronically, whenever they check mark or click on the yes or no boxes, it automatically begins tallying up their score so that you won't have to do it at the end, or they won't have to do it. One thing to keep in mind also, if to use electronically, health center staff must fill corresponding patient information, and always remember to save the tool for the electronic health record. One thing that we do suggest, if you do decide to use paper form, is to laminate it. That way, just for purposes of cleanness, or and also lamination helps. But if you don't have access to laminating, then we would suggest that you print a copy for each participant individually. So again, does the participant have consistent internet access? You want to, if they select yes, they have the option to include what type of internet service they have access to, dial-up, high speed, or maybe they just have a mobile or cellular data phone. How strong is their connection? Can the participant afford internet access, or do they have access to a smartphone? Does the participant need to access internet or devices in public shared spaces? So this is when you can brainstorm with the individuals based on the answer that they give you. Maybe kind of figure out, is there a library nearby that they can go to? Or do they have family members nearby who do have a computer or a smart device that they can use? Is there a hotspot somewhere, anywhere they can use public Wi-Fi? And then we go into the digital navigation skills. So how comfortable is the participant in using this platform? Have they used it before? Do they know how to navigate technological devices? Do they know how to download WhatsApp? And this will give you an idea of how much training you'll have to do with the individuals, with the participants. What is their need? Where are they at? Are they able to access the camera? Do they know how to enable the camera? What about the microphone? Do they have access to a microphone, and do they know how to access that? So you'll gather all this information from the assessment. And again, if they're doing it electronically, it'll automatically tally their total score down there. And then the next slide, please. Here you get to the scoring sheet. So if the individual scored anywhere from a 0 to 4, then they're really going to need, maybe they may not be ready to engage in tele-education just yet. Maybe they're lacking resources, or maybe they just need a little bit of extra help. So this is where you can assess where it is that they're at and how much help they need from you, and what referrals you can provide them with to access resources. Again, think of those creative ways to set them up with a computer, visiting a public library, school, community center. And then if they scored anywhere between a 5 to a 10, they do need still more education and a little bit more training to increase their literacy levels using the WhatsApp, but they're there. They're ready to use it. So here you provide participant additional training to build WhatsApp digital literacy skills. You can maybe show them how to set up and use the camera, show them how to access the microphone and headphones if that's something that they need. Teach the participant how to enable privacy features, because that's very important, such as maybe having a private browser or clearing any stored information or files. You can this is where you can decide if you want to schedule a trial run. Are you going to be doing that in person? Are you going to be doing that virtually, maybe via another platform you currently use? How are you going to teach them, get them the necessary skills that they are needing? And then that last scoring, they're all set. They maybe have already used WhatsApp before, right? They're ready to go. They need a little bit less training, or maybe no training at all on the WhatsApp tool. So that's your scoring sheet. And then next slide. This is an appendix. It's kind of like a sample group guideline for online chronic illness support that we created. And this is very useful, like if you are having group chats or even online support groups. This is something that you want to have for the safety of the participants, right? You want to make sure that they feel safe in their space. You want to make sure that there is respect, that everyone is respecting what is being shared in the chat or what is being discussed. You want to make sure that there's confidentiality. You want to make sure that there's no solicitation. And you want to let them know that anyone who violates, you will be able to remove them either from the group chat or from the online support group. These are just suggestions that we created, but you can also speak with your group, with your participants, and kind of gather feedback from them as to what they would like to see as part of the guidelines, and then you can create your own. So again, you can use this or you can create your own, and there's also a sample group disclaimer at the bottom that you can use, just kind of ensuring that everyone knows that it's not intended for any kind of medical advice. And then next slide. So yes, that was the end of the presentation. This guide, we do not yet have it ready to share, but as soon as we have it downloaded onto our website, we will be emailing it out to everyone, and it will also be available in Spanish. So thank you so much for those of you joining us today live. Please stay on for evaluation and Q&A. For those of you who are listening to the recording, thank you for joining.